Hi, everyone. Welcome to the Ohio Adult Allies On-Demand Learning event titled Problem Identification and Referral for Youth-Led Programs. This on-demand learning opportunity is presented by Northeast Ohio Regional Learning Collaborative leaders.
Our names are Karen Lackey and Holly Jacobson, and we'll be facilitating today's learning event. The learning objectives for the webinar are for our adult allies to be able to define problem ID and referral and its growing role in a comprehensive prevention approach. Explore how problem ID and referral can intersect with any youth-led prevention strategy or activity, and identify useful policies, procedures, community resources, and important language necessary to support a foundation for problem ID and referral. As you'll see, a comprehensive approach includes all 6 CSAP strategies: information dissemination, prevention education, alternative activities, community-based process, environmental, and problem identification and referral. What we found is often problem identification and referral is overlooked. It's assumed it doesn't fit into prevention because it sounds a little bit different. And some people are intimidated actually by the term problem identification as well as referral. They don't feel it's in their area of expertise. So this makes problem ID and problem identification and referral one of the most underutilized CSAP strategies. The definition of problem identification and referral is to identify those who have indulged in illegal or age-inappropriate use of tobacco, drugs, or alcohol in order to assess if their behavior can be reversed through education. I can see where this sounds a little bit intimidating to some people, and it's why we're here to do a little bit more educating on this topic so you can all be experts by the time we leave. In our experience, what we found is this definition also often leaves something out. In youth-led programming, the problem of focus, or what youth choose to work on, is not always substance abuse. So when we are addressing and when we talk about problem ID and referral, it goes beyond the scope of just substance abuse in youth-led programming.
So how does problem ID and referral intersect with youth-led programs? So there are so many different ways in which these two can intersect, right? There's multiple ways in which the youth-led process encounters the need for understanding and how to use problem ID and referral. So if we go back to the basics of youth-led prevention and how do we truly empower our young people to create change, we have our main, one of our main tools that we use, which is a strategic prevention framework, right? So what we're going to talk about in the next several minutes is how does problem ID and referral align with this, right? So it can happen in every one of these different areas. So whether it's an assessment, capacity, planning, implementation, or evaluation, there are potentials for the need for problem ID and referral in any of these areas, especially as you're taking your young people through this empowering planning process to create that change. We also hopefully know the strategic plan map, right? This is one of the other tools that we should be using with youth-led prevention. And so what we're noticing is that, the young people are choosing their problem of focus, right? So they're choosing their problem of focus. They're, deciding what area they want to focus on. And so they're, similar to the SPIF, at any point during the planning process and using your plan map, you can encounter areas where you need problem identification or referral. Whether, we know it or not, we have to know that it's there and that we have to plan and prepare for it.
So now to make this a little bit more relevant, we are going to run through a few case examples of how this happens in some standard youth-led prevention activities. So what I'd like you to do just for a minute, I want you to take a look at that list and think about these activities. Is this something your youth-led group does right now? Is it something you can see them needing? Something you can see them planning, or a possible activity they may come up with down the road? So don't be afraid, but we are going to jump off right now and you're going to see our faces because we do not want to have this slide up for eternity as you're listening to this. So we are going to start off with the first one. We're going to go through the first 4. Holly's going to start out with the camp experience, and then we will jump in later go through our experience, and hopefully you'll learn a little bit about why, through our mistakes, really, you have a need to have policies and procedures and understanding of problem ID and referral. Okay, thanks.
Awesome. So yeah, so our first example that we have is overnight camp experience. So I'm sure many of you have either run camp, been to camp, are planning a camp, or maybe 1,000 different camps. And so one of the things that we have noticed is that that is a huge event or activity that young people do, where we absolutely have the potential of using Problem ID and referral, right? So think about if you have, so specifically, we have a camp that our countywide leadership team, YAC, runs. We invite middle school students, they come on in. Our high school students are the ones that create the camp, they develop the camp, they run the camp, and then they train the young people, the middle schoolers when they're there. And so one of the things that we've noticed is that they tend to form relationships and they bond with their, the older people, the high school students, bond with the younger middle school students. And so what they notice is that, sometimes they'd be hanging out or doing an activity, and all of a sudden one of the younger students would share something. And the high schooler knew, like, this wasn't right, something didn't feel right. I have to tell somebody, I don't know what to do with this information. And so young people were really like starting to share information. One of the other things is like, what happens if you're at camp and you notice that, it's a 3-day camp and one of your young people is there with the same set of clothes for all 3 days, right? So there's a lot of differences, like how do we identify, like, what do we do about that? And so we realized that we had to really kind of create a whole comprehensive Problem ID referral of how do we address these issues and concerns when they do arise. Yeah.
All right, and we'll hear more about the actual policies, procedures, and what we did about that later on in the presentation. So for the next item, it was a student survey. As we said, step 1 in the SPIF is assessment. So students can gather data and start the SPIF multiple different ways of gathering information and gathering data to see what their problem of focus, the actual need is, the actual data is, so they can measure what their activities do. So we had one of our high school groups got together. They decided they would do a little survey of their peers, design a little Google survey. So I'm going to read you a few of their questions, and some of them are really great kid questions. But remember, think about how could any of these questions inadvertently, unintentionally, create a cause or need for problem ID and referral. So the first one was cute. It's like, name 3 adults in this school building you would trust to go to for the problem. Yeah, don't see any issue with that. Next one, how do you typically deal with stress? Sure, they were thinking about things like, I exercise, I pet my dog. But imagine, what if somebody said, how do you deal with stress? They're surveying 7th graders and they say, I drink often. I hide my room for days at a time. These are things that the students certainly wouldn't have expected as an answer, but certainly you could see where it would have a need for problem ID and referral. And the last one is, what makes you happy most of the time? Again, great student question. They were trying to get at coping skills. And again, there's multiple answers to that could raise a red flag for problem ID and referral. Again, typical youth-led activity. All of us do it. All of us need to do it if we use a SPIF. But sometimes there's unexpected things that happen.
And with that unexpected, the third thing that we're going to talk about is positive social media campaigns. So our young people created a positive media campaign where they were talking about all these wonderful things, positive mental health. And before we got started, going back to the SPIF process, they had to collect data, right? So they very easily were like, hey, what's the best way to collect data? They're like, well, we're going to go on and see how many positive things and how many negative things there are. And we're going to see if we can increase people, putting out positivity. And like, that sounds awesome, right? So yeah, let's go ahead and do that. Well, it's about 10:30 at night and I get a text message from a student who saw something on social media that was very, very concerning. So how does something that we think is such a positive thing potentially have a need for problem ID and referral, right? And so that student reaches out, hey, I saw something, it was concerning, what do I do from here? And so we immediately needed to know what we were going to do, what our policies were, how are we going to move forward with helping this young person and what they saw as a concern.
All right. And it's funny because that particular case, we didn't have any policies at the time. And I think what happens is you work with good people, you have good relationships, and that case worked out all right. And there was a need, there was a true need for problem ID and referral. But the number of people who got out of bed, and we were lucky enough to call the right people that picked up the phone in the middle of the night, that was pure luck. So since then, as we'll talk about later, what the actual policy is and what we normally do. So the next thing we're going to talk about is there was another excellent program our students designed a few years back. And it was high school students in the YAC group as well, the advisory council. And they saw a need at their middle school after they'd been up, they'd been to the middle school, obviously transitioned to the high school, of so many kids at middle school level that are isolated. And they became more isolated when they went to the high school. They didn't have that peer group. They didn't have that set of friends. So their activity for that year was to design a peer-to-peer mentoring program. So that we recruited high school volunteers, we had trainings, and they were matched with young people who were isolated, who had few connections. Even a lot of teachers didn't know them, at the middle school. So as we were training them and as those relationships happen, just imagine the number of conversations that they could have with a young person. One of our districts did middle school, one did elementary school. Maybe they saw that student that was in the same clothes every single week. Maybe one of those students had a bruise, or maybe one of those students reported something unhealthy that was going on at home, just as conversation. Their goal was to build relationships. When you build those relationships, conversations can happen and things can be reported. So again, a great program, great idea. They had a lot of fun, but we have to train them for the opposite. We have to have policies for the opposite just in case there's a need for problem ID.
So we just shared with you 4 different ways, or 4 different things that we have done that have been case examples of our experiences in the past of, the need for problem ID and referral. So those were unintentional ways that things happen, right? Like we didn't really expect to need problem ID and referral, but unfortunately we did. And so what we're going to talk about now is we're going to give you one more example of how we actually can use problem ID and referral. So we have again our group of our young people that said, hey, we have identified the major problem in our area as mental health. And so their problem focus was mental health. Fantastic. That's what they wanted to focus on. And so what they've determined is that their intervening variables, or the reasons that mental health was such a big concern, is that there was a huge stigma and there was a lack of young people reaching out for help. And so what they decided is that they really wanted to create a way for people to be able to say, hey, I saw that poster, I saw that thing, I heard this, and I can call and I can reach out for help and it's okay. And so what they did is they worked with our county agency that hosts our COPE line for our county, and they decided that they were going to do an information dissemination as part of their plan. And so the original poster, as you can see, is a very black and white, very sad poster. And so our young people said, no, we need to create something that is eye-catching, something that is going to open up conversation and intentionally need people to refer, right? And so this was something that was intentionally done. And they had to go through the data gathering process. They had to know who were the important people they needed to talk to, that communication, and they spoke with that agency to start to create this intentional way of needing problem ID and referral. And that was exactly their plan when they decided we do all the CSAP strategies again, but we tend to leave out that 6th one, that problem ID and referral, but theirs was intentionally identifying, hey, problem ID and referral is a huge issue in our area, and how do we fix that? So we figured out exactly like what we needed to do and made it an intentional process.
Awesome. All right, so now that you have heard all of these case examples, we get to the point where we want you to understand, and you do probably understand, the need for a plan and a need to develop policies, procedures, and understanding of problem ID and referral. So through all those examples, we have come up with several types of policies, procedures, and trainings. And we're going to give you a few ideas of what those might be and categories, and walk you through planning kernels to where you might need to add a policy, add a procedure, or at least add a training and awareness for your students, your adult allies, and your staff in your organization. So first example, what we have determined is, especially through that social media campaign one, is we needed to train our young people in what we call the see something, say something. It's our student referral procedure. So this is a multi-pronged approach. Our students are trained, if they see something, to say something very simple, and we do not train them. This is where people get intimidated by Problem ID. We don't train them in what is at risk at this point in time. Our only definition is what makes you uncomfortable. If there is something you see that makes you uncomfortable, that you think is a little bit off, then absolutely say something. Then that's when the procedure kicks in. Say something to who? That is where those midnight phone calls, came in handy, because we knew then who to write into our procedure. First line of defense, YLP coordinator. Second line, the YLP coordinator calls the director, on down the line, until we have a phone number now of every person who we need to get out of bed, who will answer the phone, and we communicate that to them so they know exactly. If something kicks in, the procedure starts, everybody knows their role. There's another student procedure that we use as well, and it links to an organizational procedure. And the mentoring program is an example of that. What we decided is in this era of being very sensitive to what young people might talk about in a mentoring relationship, we do what we call a red flags training. So our students, again, very, very simplistic, very, very simple, are given training on what is right, what is wrong, what is normal, what is a little bit off, what things you should report, what things you should not. So this is a level up of see something, say something, because they are given actual training in child abuse, sign of child abuse, neglect, and other issues that may pop up. So if there is a red flags training, and it is, again, the see something, say something kicks in, then this is an important thing to know about your own licensure, which Holly's going to talk about in a little bit. This is when things kick in, like the mandatory reporting procedures for your adult allies or for your staff. I'm an Ohio licensed social worker. I am a mandatory reporter. Anybody in any of our school systems, when we run programs, they are mandatory reporters. They are part of that school system when they walk in. So it's important to know Ohio's mandatory reporting laws. It's important to know your licensure, and it's important to know the policies of the setting that you're in. Is it a rec center? Is it a school? What are their procedures? So another one as well we use for students, and it starts with actually something you're gonna think is silly, is very important to have a written application for your YLP students. Because in our written application, we have our policies on use of substances. We have our contracts about behavior. We have many things in there when students read and sign they're committing to. It also gives us a written document that says, hey, we have to kick in this procedure of notifying parents about something. A written procedure, we have multiple procedures about what we do with students who break one of the policies, how many opportunities they get, it's discussed with first, all the way through a policy and procedure where if a behavior is bad enough, negative, or unhealthy enough, we actually notify parents, we notify school districts, and they're removed from a youth-led group. Do we have to use those very often? Certainly not. So again, knowing your organizational policies, communicating those with the people that need to know them, also knowing the policies of where your settings are, what organizations are, and making sure they match with yours and communicating about that are all very, very important. And lastly, every time you have a policy, communicating it to everybody's going to use it, and having the training so people know how to engage those policies, all critically important. And the most important one we found, and it's the one that changes the most for us because we always find something wrong with it because it's so important in Problem ID, is when we do surveys and data collection. Our survey and data collection policy and procedure is extensive. If you are going to ask any type of questions of students, there are multiple legal issues, there are multiple policy issues, there are multiple setting issues you need to consider. So that is, in a nutshell, all the policies and procedures that came from all those case examples that we used. So Holly's going to go into a little bit more now about the barriers to getting some of this work done.
Right. So yes, there's a lot of different barriers that we may face when we're deciding, or if we're even starting the process, like how do we even know where to start with problem ID and referral? And so one of the things that we've really noticed, you know, like Karen mentioned earlier, is sometimes we didn't really necessarily have a procedure when things happened. And so we just kind of had to say, let's go with what we're trained to do, with our ethics, with our whatever it is. And then we really had to sit down and say, well, what are our policies and procedures? How is this going to work? And so some of the things that the challenges and the barriers that we work through is like knowing your community resources, right? Who, you know, Karen she just talked about where that student, you know, contacted me at 10:30 at night, and we, you know, I then called Karen, and then we called, you know, the principals and we, you know, we went up the chain. We had, you know, higher ups at our local agency that answered the phone, that by that time was midnight. And, you know, you have to know your community resources. Who are you going to reach out to? Who do you have a connection with? And if you don't have a connection, start building those. Relationships are super, super, super important in everything that we do, especially, you know, in knowing how to communicate with your community and those agencies and those other people out there. And who do your young people know that they can lean on, right? Do they know that they can lean on you? Do they know who their resources are out in the community and who they can talk to? Another thing is a language barrier. Working in the school, they use language, and they may use the same language as maybe a therapist that's working at a mental health facility, but that doesn't mean the same thing. You know, and there's different language barriers. So when we're talking in prevention versus education versus, you know, mental health, there may be similar words that mean something totally different. Or there may be 3 different words that mean the same thing. And so we really have to understand what the language is in all those fields to be able to work it, so that when we're writing our policies and procedures, that we can say, you know, whoever sees this. So if I'm an outside organization and I'm going into a school, they understand what our policies and procedures are because it aligns with their wording, and they know what that is. And same thing, if we're reaching out to a community agency, they know what that is and align with the school and their language. And then the other barrier, which is one that we, you know, don't necessarily always think of, you know, not only do I have my OCPC, but I also am a licensed school counselor, right? So I have 2 licenses that I need to consider. So ethics wise, legal issues wise, I need to consider both of those, as well as not only me, but I have somebody that oversees me, right? Karen is, you know, she's a licensed social worker. So she has a different set of licenses and issues and not issues, but ethics and all those different things. So we really have to take into consideration everybody's licensure, and especially those people that are working together, and where do we go from here, and who's do you necessarily follow? And so that was a really, I think, probably one of our biggest barriers, and really working through problem ID and referral, is whose license do you fall under, and how do you try to hit all of them at the same time? And so, you know, these are 3, I think, the biggest barriers that tend to be out there. And the other one that we don't have listed on here is just that fear of even getting started, right? That of like, oh, I don't know if I'm going to need it. You're going to need it at some point. So just get started. And one of the things that, you know, we like to recommend is just talk to other preventionists, talk to people, you know, what do they see? What policies and procedures do they have? And that fear of even just starting, that's okay. It's normal, but, you know, just work through it. You can do this. Mm-hmm. So, yeah.
That's awesome. And I promise you, it's a lot easier than waiting till something happens to get started. I mean, we are preventionists, and we made that mistake, and we do not recommend it. So we thank you very much for spending some time with us to talk about problem ID and referral. If you need any help, you're always welcome to reach out to us at any point in time. And please contact us, get started, and have a great year. All right. Thank you very much.